Beginning of the year, pick 2 days out, pre-schedule. I'm doing a blood panel, checking my micronutrients, checking cholesterol, checking hormone, checking liver function, and I'm doing a cancer risk assessment. Then I'm doing the functional tests, which are going to be body composition, full body mobility test, a functional strength test, and a VO2 max test. Hey everyone, Derrick Hines here. Welcome to the podcast where I'll share with you the patterns, insights, research, and technologies that we use in my own pain and performance practice to help people improve their health, speed their healing, and increase their longevity. Thanks for listening. I hope you enjoy it. All right, my friends, welcome to another episode of the Pain and Performance Podcast. On this episode, one of the things that we're going to cover is a complete guide to testing and quantifying your health. I'm really excited about this because I get this question a lot where people are like, what should I be testing? What should I be doing to track my health to make sure that I'm doing the right things, that I'm eating the right things, recovering the right way? So I want to go through everything that we can do to quantify our health right now. And this has progressed. This is one of the fields that has actually improved the most over the last, let's say, 5 or 10 years. So I'm excited. I'm a practitioner of these things and have done many of these things. And of course, y'all know me, I geek out over all of this stuff, and digging into my results is always exciting for me to kind of try and figure out where things have changed, what has gone wrong, why my results are different than they should be. But that's where some of this gets to be very powerful, is that it gives you a way of lifting the hood to see what's going on. Is everything clean? Is everything healthy? That's much more than the subjective, do I feel okay? Like, that's such a low-tech way of trying to stay healthy. And the problem with it is many of us have taught ourselves to almost ignore the signals of our body, that then even if our body's trying to communicate that there's a problem with energy, our headaches, our nerve symptoms, our rest, our sleep, do we even get that signal? We self-medicate, quote unquote, using so many things today, whether that's medication or caffeine, or even, look, some of these supplements that are out are really powerful. Are we using them to cover up some issues? Well, if you're not testing things, you don't know. So that's my big thing with this, is that, are we doing some unnecessary tests in medicine? Maybe. And I think the net positive, if we understand what we're testing for, is better. That the net positive is going to be a better thing if you're testing and quantifying your health than if you're not. So that's my spill on it. I think, unfortunately, a lot of this stuff doesn't get done because insurance companies don't pay for them. And that's the pushback that a lot of people have, is that, we're doing this, and it started out as insurance companies saying we didn't have enough research. And then that kind of somehow ended up into this situation where insurance companies were like, look, the average time that someone spends with an insurance company is like, 4 years, I think. And if we pay to do all of this preventative testing for you, and then you leave and go to one of our competitors, we just paid to help them have a better customer. This is the insurance companies speaking. And I think that's the problem with it, is that people have to take this into their own hands. I still think that if you're doing this testing, in the long run, you're going to save money, even if you're coming out of pocket for this stuff, because you're either not going to be wasting money on excessive medical treatments in the future. A lot of times when I have patients who do this testing, we get to take them off of some medications and supplements that they didn't need to be taking because their results come back and look great. So I still think, even though you have to pay for these things, in a lot of cases, they are really, really good. So when we're using this information, we're going to actually go through and try to separate these tests into a couple of different categories. The first one is going to be the everyone, every year tests. So these are the tests that I think everyone should do every single year, at least one time. And why, we'll dive into that. So if we're looking at the test that I think everyone should do every year, we're going to do initially a micronutrient and vitamin levels test. This gives us a lot of information about all of the little molecules that make up all of the big activities in our body. I'll dive into that in just a minute. I think everyone should get an in-depth cholesterol panel. It's so important for us to know this stuff, so we might as well test it every year and be ahead of it and be able to change that. Hormone levels and balancing should be on the list for sure. I think that we should have a resting glucose or oral glucose tolerance test done to make sure that our cells are doing what they're supposed to be doing, and a liver function test. I will also put in here that I think we should probably do an inflammatory panel every year just to make sure that we're not kind of having some underlying systemic issues that are creating inflammation. And if we're checking that somewhat regularly, we can catch those things ahead of time. If we go in and break these things down, let's look at a micronutrient test. This is like, do you have the building blocks of health? So your micronutrients are just that, the small nutrients that your body uses to put together to basically do almost all of the processes in our body. Anything that we need in terms of energy creation, cellular function, nerve signals, all of these things require micronutrients to actually function. And so that's something that I think we should test every year. And in that micronutrient test, we should check all of our vitamins and antioxidants. So y'all have heard me probably talk about it on here. There's a bunch of companies out there. I have no affiliation with these people or with any of them for that matter. I've used SpectraCell for a number of years. They give really good information. They seem to do great testing. I've not had issues with them in terms of like quality control or anything like that. So that's what we use. But when we're looking at these micronutrient tests, basically you get a leading indicator of how your body is processing food and nutrients and vitamins and minerals that will help to give you actionable steps. And that's my thing with doing testing is, do I have an action that I can take from it? You know, if we get this test back and your vitamin D levels are very, very low, then we can take action on that. Make sure you're increasing sun time. Start taking vitamin D. Start increasing foods that are high in vitamin D. Retest. Did I do enough to make a big change? So I've talked about it on here. My 2 tests ago, my vitamin B2 was low. Riboflavin was in the floor, deficient. I was not having any issues. Your B vitamins are really important for brain and nerve health. So who knows, if I left it there, I may have started saying, hey, I'm having focus issues. I'm having headaches. I'm having nerve issues. I did not. And getting that test done, I don't know how long it had been like that, but no longer than a year, I started increasing B2 supplementation. I started increasing foods. And guess what? My next test was perfect. We had elevated it all the way up back into normal levels. I'm going to continue with some of the foods, but now I'll roll off of the supplementation and then I get to retest. Does it stay? Did it maintain those levels, or do I need to go back into some deeper level of action? So we really want to test as deep as you can all of the major vitamins and minerals that something like SpectraCell will test. Now, I'll tell you, there's a lot of home tests that are out there that they're mailing to your house, and you can do it and track it. Life Force is doing this. Inside Tracker is doing this. I really like that, and I think at some point in the future, we may do a little comparison where we do both of those and see what our results come back as, and do SpectraCell and just check all 3. What are the levels? What are the differences? So I think around my next SpectraCell test, I'm going to give those a try. They all have different price points. All end up being in the $500 to $700 per in-depth test. But the great thing about this is you really get the information about what do you need to keep your cells and all of your internal hormone production, energy production in a good way before it gets too bad. So you really want to know ahead of time before you start to feel the symptoms. And this gives us a way of doing that. Antioxidant test should be wrapped into this one single blood test. Most of the ones I've seen are where it's going to measure glutathione at least, which is your body's master antioxidant. I had a test at some point in the last few years. I take glutathione every day, and my glutathione levels were on the low end of normal, and that's not acceptable for me. I know that's like you're doing okay, and if I went to my primary care doctor, he'd say, yeah, it's fine. That's not where I want to be. I want my oxidative health to be really, really good. So I was taking a regular dose for a little while. I went up to a dose and a half of the glutathione supplement that I take, and got those levels back up and then back down again. So you'll hear this is a kind of a common theme. This is why I say these things can save money. How many things are people taking that they could have stopped taking years ago, and they've wasted, quote unquote, hundreds of thousands of dollars taking some of these things. That's my first test for everyone every year, is make sure you're getting a micronutrient, vitamin, and antioxidant panel done. There's a lot of access to this, but it gives you such great actionable information. I can't tell you how many patients I've had who come back and we get, vitamin B, vitamin E, vitamin D levels into normal ranges, and they are like, I feel like a new person. So helpful just to have the right stuff in your body before you undertake a lot of major health changes. I think this should be on there. If you're about to go through a big health transformation, start taking this stuff. So cholesterol would be next on my list. Is that, we've heard of good and bad cholesterol. I think that gets confusing. Cholesterol is the small cell that is, I love the boat analogy. So cholesterol is carried on boats throughout your body. When we talk of good and bad cholesterol, the strange thing is we're actually talking about the boat usually. So that boat is basically a lipoprotein, and the lipoproteins are much more important to measure than the cholesterol that they carry. So if we do a really good lipoprotein test, LDLP or an ApoB test, these things can measure the apolipoproteins. So what you'd be looking at is a measure of your particle sizes of the lipoprotein. And we know that there's some of these boats that are carrying different densities of cholesterol. And that's something that we want to pay attention to. That's where you can start to need to take action on cholesterol, whether that be lifestyle changes, dietary changes, or medication. If you are in a genetic category where your cholesterol levels of your lipoprotein levels in your VLDL or your LDL particle sizes are in an unhealthy state, we need to fix those things. So I don't want this to be a podcast where we dive deep into like all about what these tests mean, but you want to know that you're measuring your lipoproteins so that we're getting the particle sizes in that test so you can actually do something to change the true health of your cardiovascular system. That's what we're trying to look at with this is cholesterol. In terms of cholesterol is, am I at risk if I don't do something? And that's the important metric you're trying to measure here. Just getting, the regular cholesterol test that's not looking at particle size done, I don't think gives you a ton of actionable information because you're just looking at, hey, you have higher numbers of the cholesterol in your body. That's not quite as highly associated with cardiovascular risk factors. Certainly if you're in the absence of inflammation. That's one of the reasons that we add inflammation onto this yearly panel. I do like getting a full hormone panel done for a lot of people and for a lot of reasons. Doing this gives you, again, this leading indicator of something you want to take action on. So if you're looking at a hormone panel and you're getting levels of DHEA, luteinizing hormone, TSH, thyroid hormones, and you're able to go through and check all of these things. Of course, for men, we're checking testosterone, progesterone, men and women. I find that women do much better whenever we find low testosterone, getting testosterone levels into normal ranges. Same thing, people feel like they absolutely have been given a new lease on life. So if you're dealing with like energy issues or health issues, the first place we want to start with that is or at least one of the first few places we want to start is hormone levels. So, a lot of these things give you some information that correlates back to that micronutrient test. So your micronutrients in a lot of ways and the vitamins and minerals that are involved in that are used to be put together in the production of hormones. So very often, if we see a hormone level that is low or dysfunctional, we can trace that back to a micronutrient level that is dysfunctional. So when we're looking at these things, of course, there's a lot that can be done in here. Getting a full one will often include, insulin, TSH, free T3, reverse T3, free T4, DHEA, LH, FSH, progesterone, testosterone, DHT. You probably add in some inflammatory markers in there if we're checking it. So you would do IGF-1, you would do high sensitivity C-reactive protein. And that gives us a great identifier of, from a chemical makeup, is my body making the right things to send signals to my cells to help me function well? This one, I think, gives you a little bit more work if it's not in good standing, but way, way better to find that out before things start to get really irregular and you start to have some major issues with it. That's one that's on this yearly kind of test. And just to put this in right here, what I do is basically at the beginning of my year, I have a morning blocked off where I go and do a blood draw. So I know this sounds like a lot. I'm going and doing one blood draw, and that runs all of these tests at one time. So it's not something that you're having to do a bunch of visits for. I do one good blood draw, and that gets me micronutrient levels. I'm doing cholesterol and hormone levels, and I'm able to do that all in like a morning. So it's not something that you're going to have to spend a ton of time. You just have to get the test ready. So the other thing that I think is really important for you to know every year is, how is your body processing sugar specifically? So there's something called an oral glucose tolerance test. And basically this is, how can my body clear glucose? If I take glucose in, is my body able to process that well? We see that in certain people, certainly in diabetics, that's not the case. And we need to do something about that. We need to start by changing the body's reaction to simple sugars, glucose specifically. If your body's having trouble with glucose or sugar, then you're likely going to have difficulty with inflammation, diabetes, hormone regulation, blood sugar, heart disease, you name it. Alzheimer's is even associated with this. So this is something that you want to do at least once a year. Once you hit, probably to me, 40, if you've had any body issues, if you've had any like difficulty losing weight that you didn't have before, then yes, go ahead and start with this. Your primary care doctor will probably order this for you. What we look at for this stuff is, your fasting glucose should be less than 90, ideally. Your 1 hour should be less than, let's say, 130, and your 2 hours should be less than 100. Your fasting insulin should be less than 25. Ideally, we'd like that much lower, less than 10, less than 6. Your 1 hour, ideally less than 30 would be my kind of preference, but they say anything less than probably 270, 276 actually at your 1 hour, and then at your 2 hour, 16 to 166 is the normal range, but we do want that, in a perfect situation, less than 20. So if you're up at the 150 range, you're like, okay, I need to do something. I need to start working on my body's ability to handle these things. So this is a good spot where we start to look at a continuous glucose monitor. I've gotten this question a lot. I think when someone does an oral glucose tolerance test, it tells us, hey, your body's having trouble. When we give you glucose, it's having trouble clearing that. So part of that is you need to start to, make sure that you're monitoring sugar intake, you're monitoring things that convert into sugar really easily. So all these simple carbohydrates, we need to make sure that you're paying attention to those things because your body's not processing it well. A continuous glucose monitor is going to give you a little bit different information. So one is like, how can your body do when we give it that thing, when we give it glucose, how does your body process it? The continuous glucose monitor is going to monitor based on all of the foods that you are eating. So based on what you eat, how is your body reacting? And so the reason that I find continuous glucose monitors give people so much information is that's something you have a lot of control over. Is if you are consuming things that cause spikes, can we do some stuff that improves your body's ability to handle glucose? Sure. In the short term, we probably want to remove those things that are stressing that system now so that we get you healthier, so that some of these systems can recover better and you can start to get your metabolic health back into order. So I think those two are not mutually exclusive to me. I think there's certainly a place where once a year for a couple of weeks, you do a very in-depth food journal and really track the times and things that you eat while you're wearing a continuous glucose monitor. And you really see, is there some stuff that I'm consuming that my body's not processing well? And then at the same time, perhaps we are doing, not at the same 2-week window, but during your yearly testing, you do an oral glucose tolerance test to learn how is my body overall processing sugars? How is my metabolic health in terms of that? So I don't think they take the place of one another, but I think you'll probably get more actionable information at the beginning from a CGM, and those have gotten much more readily available for everyone. But there's so much associated with blood sugar levels and monitoring, making sure that process is functioning well for your body, that you just have to have that test done at least once a year to make sure that you are in the right place. So that would be really the places that I would start in the every year test. I think the one thing that we add on to that for a lot of people is this liver function test, where we want to know how well your liver is functioning. Your liver is the major filter of your body, and it needs to be functioning quite well. In this area, unfortunately, I'm in South Louisiana. A lot of people are probably functioning with suboptimal liver activity, and that creates a lot of problems. That creates a lot of toxicity that inhibits your body's ability to clear out toxins and issues. So if we don't have a good idea of that, and that gives you actionable information, there's good things that you can do to improve your liver health. Today, there's a lot of this stuff that's coming out. We've talked to people who have started using different versions of glutathione stacks. Glutathione suppositories is something that we've provided to our patients to really get those levels up quickly, and that improves liver health in a lot of ways. There's some other treatments that have started to come out whenever you're looking at the research around non-alcoholic fatty liver disease that has improved, but we want to know ahead of time. So that would be one that you would start to add into your repertoire of your yearly tests and make sure that you are measuring those. So that could all be done. I want to put a bow on that in like one blood draw section where you go and you're like, here's the test I want to run. Can we get a micronutrient test done? Can I get blood sugar, hormone, cholesterol checkup? And can you get me all of those? And I kind of sit there and do it again. There's multiple companies that are sending that collection of tests to your house, and you just have to go and get a blood draw. But I think those are really smart for you to measure. So that's the blood draw every year test. there's a few other things I want to look at every year for people. And the first one is going to be body composition. I want to know your body composition. We know that just about everything is associated with health and longevity is worse, the worse off your body composition in terms of higher fat percentage to low muscle percentage. And just about everything is better in terms of health, healing, and longevity when you have lower fat percentage and higher muscle mass. So, these are measuring, when you look at body composition, basically what it's doing is it is measuring the amount of tissue in your body that is fat, the amount of tissue that is muscle. Then you'll get like kind of a measure of bones and other mass related tissues. So if we look at the muscle mass and the body fat percentage, and we track that in terms of healthy ranges for your age group, we get a lot of information about how much time you need to be spending on these things. Testing body composition, there's a bunch of ways. Some of you have maybe done like the bioelectric impedance. This is the stuff you'll find at a gym. Decent for tracking your progress or your changes, but not so great for giving you a really good output of what is going on inside your body. The best thing right now, I think, is probably DEXA scan. This is the most accessible. It's not super expensive, and it gives us really good information in terms of bone density, muscle, and fat. So we have a great answer of body composition, and that's what I would recommend for people. There are some newer ones that have come out that are quite helpful in terms of getting great information. I did a bod pod test, which is basically like a little pod that you get into, changes the air pressure, and it's connected to a computer, and it can measure a lot. This is over my pay grade from that. Gave a really good printout. I would still push somebody to go towards DEXA right now. That's the easiest, most accessible, and most accurate that you can do. We've done skin folds in the office for people, and for lack of anything else, at least you have something that you can do, and skin folds can be quite accurate if people have been trained to do it and they're doing it the same over and over again. But again, you're kind of relying on that person, and if you move or something like that and you have somebody else doing it, it's not going to be well correlated. But if you go and get a DEXA in Colorado versus Louisiana or Florida, those results are going to track perfectly, or quite perfectly. So we look at this quite a bit whenever we're dealing with improving health. And, let's say I have a man in his 40s, excellent at that point would be 13% body fat. But we want you to feel really, really good. And so a lot of times I want people to start looking more at the norms of the age range underneath them of the 30 to 39. You want to feel 10 years younger, operate 10 years younger, measure yourself on the norms 10 years younger. So if you're, in your 40 to 49, my goal for somebody at that, it would be to be at the excellent age range of a 30 to 39 year old, which is 11% body fat. Tough, but achievable. I've had patients in their 60s who've gotten down to that. Takes some work and certainly takes a lot of health improvement. But, the nice thing is we do have a lot of data. So if you're, let's say a woman in your 60s, then we know that if you're at 30% body fat, you're at average. You improving 10 percentage points to 20% body fat puts you in the excellent age range, and the demographic of your body functioning is going to be so much better if you can make those changes to get some of the body fat under control. This is not the podcast for it, but I've gotten a lot of questions about using GLP-1s to help with that. We're going to circle back to that, but I think there's a lot of options of how to use modern medicine to improve this stuff, to get there. And there are people, if you're doing all the right things and you're having trouble, yes, use what we have available. We continue to progress in healthcare so that we can use this information. So that's what I want for people. Make sure that they're improving and we're getting the metrics that we can that tell us you're going to live a healthier life. So that's something that we want people to do. Let's check that. At the same time, I want to know muscle strength. So when we look at this, is how strong are you and how much can you use your body to be active and, let's say, lift weights, push with your legs. We do a series of full body tests where we're checking strength of everything and we're checking unilateral strength, your left leg versus your right, your left arm versus your right, so that we can start to see, are there some things that might be slipping for your age range? This is something you could probably find at a great PT or a great, maybe some really high level gyms would give you some of this information. But if we can figure out your overall strength and where you stack up in terms of norms for that, hopefully y'all listened to my most recent episode with Tonal, that with Troy Taylor. Such a great episode, and the amount of data that they have on norms and who's doing well and what changes in terms of people who are being active and sticking with it and how much they can improve their strength over time, no matter what age group they're in. So fantastic that we know, look, this isn't a thing that happens where you can't get stronger as you age. They've got the actual data and measurements to show you 100% we can make that change even if you're 90 years old. So I want to check that every year, and I want a full body mobility test. I want to see how your body moves. We do an AI assisted movement scan in our office that gives us super in-depth information and gives us a grade for all of your movements while it makes a 3D model of your body. We know how well you're moving, and if you get a full body mobility test, you're going to stave off injuries that may come up later on. So it's one of those things like, let's check the range of motion of your neck, your shoulders, your upper back, your lower back, your rib cage, your hips, knees, ankles, elbows, and wrists. I may have missed one in there, but let's check those things. If your neck range of motion has started to decrease and you're not moving the joints and muscles in there, it's only a matter of time before something happens. And so you need to improve that, and it gives you action. That gives me something I can do so that I prevent arthritis, or I prevent a neck injury, or I prevent a joint problem, whatever it might be. I know that I'm losing this range of motion, and now I have something that I can do and come back and retest it. Did I get better? Am I moving better? Did I improve how my body's functioning so that I'm going to feel better and operate better? So that's why that gives us such great information. We give a printout. Here's the things you do for each one. Here's how you need to improve. Let's see you in 6 months and make sure that these things changed. It's a really good thing to have on your yearly test. And I think the other thing that I would say in that is we want to do a cardiovascular test. The best thing for this is a VO2 max. And basically what that is the maximum volume of oxygen consumption that your body can handle. So during this test, you will be performing an exercise. Usually it's going to be on a bike, and it really has a big impact on health and aging. There was a study done by, what was his name? Mag Sater. I might be saying his name wrong. Anyway, he did 122,000 people. And what they found was that someone with a low VO2 max, if they improve their training to get even just to below level, they'll improve their risk of fatality, all-cause mortality, by 50%. If that person improves their VO2 max to above average or just to average, they'll reduce their risk of all causes of mortality by 75%. Those numbers are gigantic. So if you are someone who is in a very low VO2 max, so these people are getting tired walking across a room or walking upstairs, any of that stuff, and they start doing cardiovascular training, they start doing VO2 max training, where we're increasing your body's ability to to process oxygen, get oxygen to the tissues, and your heart's ability to pump that throughout the body, you reduce your risk of health-related issues dramatically. I mean, 50 to 75%, and that's not even going like low to high. That's going low to average. So that's achievable for most people. So that's the physical side of our every year, everyone tests. The last thing that I'll put on here is a cancer screening. There is some issues with being able to check everything, and I've heard the pros and cons. I still think there's more pros to getting a cancer risk assessment done every year. There's great advances in liquid biopsy tests. The Gallery test is the one that has really pushed the envelope with this, so they can do a blood draw and they can detect multiple types of cancer. The studies show there's like only a 1% false positive rate. The numbers are really good for this. And a lot of people I've talked to is like, they talk about this like the I don't want to know thing. Oh, I don't want to know that stuff. When you look at early detection in cancer gives us incredible results. We have made so much improvements in being able to treat and defeat cancer that we need to really push the idea that knowing early means that you get very easy treatment. It doesn't put anybody at an imposition. Your family's not going through this major thing. You have done everything to make this better for yourself, for your health, for you to show up for everyone, and to make it much easier and better for them. Later stage diagnosis, stage 3 or 4. Look, everything is constantly changing on these things, and I'd never want any of my patients to be like lumped into norms. I'm like, look, when they say 20%, that's a lot of people that fall into that bucket. So don't think about that. But if you look at late stage diagnosis, we know that we have worse outcomes across the board. So we want to detect this stuff as early as possible. And with the research out there and the technology out there, we can at least start taking steps towards that. So, on top of early stage diagnosis having so much better outcomes, today I think it's like 80% of cancers are diagnosed late, stage 3 or 4. So we can really move the needle on cancer outcomes if we have more people who are getting tested early. So everyone, every year, get a cancer screening so that you're getting a leg up on what you need to do to improve the outcome of that. So basically, we tell people to do this in 2 days. First day, show up, do a morning, do a blood draw, and you knock out your micronutrient panel, your cholesterol, your hormone. You can probably do the cancer risk assessment and your liver assessment at the same time. So you can knock that out in one blood panel or one blood draw, or you can research some of the ones that send these things to your house. There's a bunch out there, but if you start looking up Life Force or Inside Tracker, competitors or any of that stuff, you'll probably see that there's even more than when this podcast was recorded. Look into, so that's the morning. Then we would try and do an afternoon where we go and do one part of the physical assessment. So a VO2 max test, and you're pushing yourself to do that. And that would end it. That's your day. Then the next part, we're going to do a, next day and like separate these by 6 months, right? Then we would do a glucose tolerance test somewhere in there. You're doing a continuous glucose monitor if you can. And then, so that's your morning. And then you would go to your favorite PT or healthcare practitioner, and you would do a body composition, a full body mobility test, a functional strength, an asymmetry test. And that's your day 2. In 2 days, the amount of actionable information that you'll be putting into your life is going to be just so much further ahead than anyone else that will be doing some of these tests. So like that's the 2 days that you need to go through so that you can kind of get a leg up on a lot of this stuff when you're trying to go through health testing. You're trying to kind of change any aspect, we need to know what's going on inside. And getting this information gives you just a ton of information that you can actually use. I hope that doesn't sound like a lot. To live super healthy and have great information for 365 days, for you to dedicate 2 days to finding out where you're at and be able to pop the hood and take a look inside, I think is really, really powerful. One of the things that we don't always put on this, but I'm starting to lean towards more people needing it, is the inflammatory test. And basically we look at HSCRP, high sensitivity C-reactive protein, which is the amount of C-reactive protein in blood plasma. So CRPs are released by the liver as part of a systemic inflammatory response when we're getting inflamed throughout our system. We'll also usually look at interleukins, specifically a blood test that shows interleukin 1 and interleukin 6 often tells us that your body's dealing with some systemic inflammation. Tumor necrosis factor, TNF alpha, is another one that will be often, all of these would be in an inflammatory panel, and you could check all of those in one little blood draw. A lot of times if we have somebody who's coming to us with an injury, with a problem, then in that we want to know this. I want to know how inflamed the system is, because it's hard for your body to heal if it's putting out all these fires. And that's an important thing to start with. So you're healthy, you're doing great, then you're just doing kind of every year, micronutrient panel, cholesterol, hormone, still do a cancer risk and do a glucose, and then do your body composition, full body mobility, strength, and VO2 max is the physical tests. So, but if you're dealing with something, you've had some problems, you've had some pain that's not healing, probably tack that inflammatory test on there so that you have a bit more information about the inflammation your body's dealing with. And we can get specific once we get to that stage. You know, these things kind of open up a level deeper if we need to. If there's something that needs to be looked at, that group of tests will tell you where to dig deeper. So that's why I like that, to be able to really dive deep into your health and find out what you need to be doing. So that's my every year, what we should go through. I do think there's some one-time tests we should cover here real quick. These are things you should consider if you don't know your family history real well. So there's an APOE genotype. This is a genetic test that you can do that is a test for Alzheimer's and cardiac risk. We talked a lot about the TV series with Chris Hemsworth and Peter Attia, where Chris Hemsworth was diagnosed. I might be messing up who these, if was it Chris Hemsworth, I don't remember exactly, but he found out that he had 2E4 genotypes, or genes there, and that puts him in a high risk for Alzheimer's disease. So like each E4, that gives a decent increase in risk of Alzheimer's. So, in that situation, he's like, look, this is probably the best information you could get, because knowing this information and making the changes and being very aggressive to prevent anything that leads you down this pathway will make it to where you don't get it. Will make it to where you live a super healthy life because you're making all these changes, and you don't end up with Alzheimer's. So it could be the best thing that's ever happened to you, to know you need to be more aggressive at preventing this than anyone else. So if you have a great family history and you know that, no one in your last, quite a few decade family tree has not had any forms of Alzheimer's, dementia, anything like that, you may not be at risk for it. I think it's a good test to do. You do it one time. It's usually done with like a simple cheek swab, and you can get that test done quite easily. So that's an APOE genotype test. The other one, and actually I talked about this last week with somebody, is the MTHFR mutation test. So this is actually looking at a variant on the MTHFR gene that's present in about 30 to 40% of Americans. So if you have the mutation, it limits your ability to use folate for methylation, which can cause issues. Methylation is basically your body's ability to transfer a methyl group from one molecule to another in order to turn on and off certain activities. I'm trying not to confuse y'all, but it basically acts like a switch to help with DNA production and repair, liver detoxification, brain health, immune response, hormone production. So it gives you a good idea of how your body is going to use folate. If you have one of those mutations, your body's going to have a tough time using folate to turn on all of those activities in terms of DNA repair, liver detox, brain health, all of that we just went through. So in a lot of these cases, they'll often require that we need to increase choline, like 1,200 milligrams a day. And, a lot of times we'll want to also add creatine monohydrate, like 5 grams a day. That's another really good one when people have an MTHFR mutation. So you can mitigate some of those effects if you supplement with choline. So that's the MTHFR mutation that you would want to test maybe once. Test it along with your APOE genotype. These are one-time tests. You know whether you have it or you don't, and you can adapt and change based on that information. Again, that one's done with a simple cheek swab usually. So those are the tests that we want to do for everyone. I think that's the important stuff that everybody needs to know in terms of what tests do I need to run, when should I run them, and how much information do I get that I can actually take action on. This does lead to a little bit of a deeper conversation about tracking our health on kind of a daily and weekly basis. We're going to do kind of a series of these podcasts in terms of what you can do. So watch out for that one. That one's going to be coming up soon. That is going to be all about health tracking and measuring your progress when you're making changes on these things. But in terms of what tests you should do to keep yourself healthy, keep you feeling great, and not waiting until you start to feel a problem, this is the best and easiest collection that I've had patients do. So schedule beginning of the year, pick 2 days out, pre-schedule. I'm doing a blood panel, checking my micronutrients, checking cholesterol, checking hormone, checking liver function, and I'm doing a cancer risk assessment. Then I'm doing the functional tests, which are going to be body composition, full body mobility test, a functional strength test, and a VO2 max test. At some point, I'm doing an oral glucose tolerance test in there, and that gets my 2 days. That knocks it out. If I'm having issues, throw in during that blood draw test an inflammatory panel. Won't be a big deal to add that on to that test. They might need one more little bit of a blood draw, but and that's it. You probably finish all of this stuff in 2 actually half days a year. So you're talking about one full commitment, one full day that you get all of this stuff knocked out, and you really have some actionable information that you can take action on, that you can implement new things into your life that make you function better, heal better, feel better. So I hope that helps out there. I know that's a decent amount of information. Hopefully that's broken down. Each of these tests you can kind of just jot down and ask your healthcare provider. They should be able to give you at least some direction on where to go and find some of that stuff. And if y'all want to know more about this stuff, let me know. I really am thinking about doing kind of a comparison of maybe the 3 major at-home versions of this kind of full health tracking, health testing kit that some of these companies are doing, and just kind of see. The jury's still out on a few of those. I like the convenience of it and putting some of this stuff as an all-in-one. So let me know if you'd like to hear more about that, and we might put some things together for you. So I hope that helps. I hope y'all have some good notes, and let me know what questions you have. You can hit me up online. Instagram's probably our most active at Derrick B. Hines. That's 2 R's, ICKBHINES. Instagram at Derrick B. Hines. And you can always shoot us an email, derrick@derrickhines.com. For any patient information, go to acadianapain.com. And I promise one of our amazing team members will reach out to you soon. So have a great day, everybody.